is a very different reaction from past epidemics. In 1968, the Hong Kong flu killed 1 million people worldwide and more than 100,000 in the US when our population was much smaller. I was a college student in 1968, and I have no memory of a virus going around at that time. Schools and businesses were not shut down, and no one imagined that it was the government's job to handle or to fight that virus. It wasn't even much of a news story. It has been pointed out that the Woodstock Music Festival was held while the Hong Kong flu epidemic was still going on in 1969, and that is true. To say that there was no social distancing at Woodstock would be an understatement, but at the time, no one thought anything about it. But that was a different era. Today, most Americans seem to have lost the idea that our government is supposed to be limited, especially the federal government, and that government is not omnicompetent. In 1976, a Democratic politician criticized Hubert Humphrey. He said, quote, "I think the thing that's most wrong with Hubert Humphrey is that he is not cognizant of the limited, finite ability government has to deal with people's problems." Who said that? Joe Biden. We've come a long way since then in our expectations of government, and not in a good direction. Now, the second striking fact about the politics of coronavirus has been the willingness of Americans to put up with, and for the most part to endorse, fundamental restrictions on their freedoms. In state after state, we have seen governors issue stay-home orders that literally directed Americans to stay in their houses, except to the limited extent they were permitted to go out by the government. Would prior generations of Americans have submitted meekly to orders to stay in their homes, close their businesses, and so forth? I don't think so. And the shutdowns in nearly every state have dragged on for months, long after the original flatten the curve rationale has been forgotten. The shutdowns are starting to feel permanent. And by the way, do you even remember that when there was an explicit rationale for the shutdowns? This is just brief, it's just temporary. We're just trying to flatten the curve. Same number of infections, just spread over a longer period of time. That whole rationale has now completely gone by the boards. Most recently, mask mandates have been added, and almost all Americans have dutifully donned masks, even though we have no idea whether they're actually doing any good. So why has there been relatively little political pushback against the shutdown orders? I think there are several reasons. First, the emergency posed by COVID-19 has been grossly exaggerated to an extent that I think can only be seen as deliberate. Remember that early on, government at all levels purported to be acting in reliance on models that predicted millions of deaths in the United States. My own state, Minnesota, created its own model that predicted more than 70,000 deaths in our state without a shutdown and 50,000 deaths with a shutdown. We learned later that the model had been created by a few graduate students over a weekend, but by then it was too late. All of these models turned out to be ridiculously off target. But instead of saying, oops, never mind, governors simply kept in place the lockdown orders that originally had been predicated on them. Now, I think the Centers for Disease Control has also contributed to the public's exaggerated sense of the virus's danger in a number of ways. One of the most important was the guidance it gave to the states to count deaths as COVID fatalities, even if COVID was not the immediate cause of death. The clearest statement I've seen of this practice came from the head of the Illinois Department of Health, who was giving a press conference, and she said, "When we classify a death as COVID-related, we are not saying that it was the cause of death. A person could be dying of cancer and be in hospice care, but if he happens also to have COVID, we will count that death in the COVID column. When we do that, we are not saying it was the cause of death." That's a very, very important point, I think. And the federal government has compounded the problem by offering cash incentives to hospitals to classify patients as COVID-related and deaths as COVID-related. Under the CARES Act, Medicare reimbursements are increased by 20% if there is a COVID diagnosis. So we are literally paying to maximize the number of reported COVID patients and COVID deaths. What all this means is that every headline that you have seen trumpeting the claim that the Wuhan virus has killed 180,000 people in the US, or whatever that number, wherever that number stands at the moment, every headline you've seen trumpeting that claim is wrong. What the actual number of deaths caused by COVID is, no one knows. But the scare campaign mounted by the media has given the public an impression of COVID's lethality far beyond anything promoted by CDC. You may have heard about the international survey that was done by Kext CNC. That firm asked the question, how many people in your country have died from coronavirus as a percentage of the population? In the US, the average response was 9%. Now, 9%, think of that. That would be around 30 million people, which is worse by 2 orders of magnitude than the most pessimistic current estimates. Now, how did the American people come to be so grotesquely misinformed? I can't read the minds of the people at the CDC, the modelers, various public health officials, reporters and editors, and so forth. But I think it is a plausible guess that the sustained overhyping of COVID was a deliberate attempt on the part of some of these people to create an issue that might cost President Trump a second term. I think we can infer that from the fact that hysterical exaggerations of COVID's lethality have been coupled with constant attacks on the president's actions in response to the virus, many of which attacks have been completely groundless and even nonsensical. So the creation of an overhyped emergency certainly helps to explain why Americans have been so accepting of limitations on their freedom. But I think there's more to the story than that. I think another reason why the shutdowns have not been more politically costly to governors is because many people don't mind them much. To a great extent, what we have seen has been shut down theater. Small businesses are closed, but as Alex pointed out, Target and Walmart are open. Meatpacking plants have frequently been hotbeds of COVID infection, but they haven't been closed down other than briefly in an individual case in response to a particular outbreak. Why is that? Well, it's because we need meat in the grocery stores. Without meat in the grocery stores, voters would get restless. And I think the ultimate proof of the shutdown's basic lack of seriousness is that while it is deemed too dangerous in many states to go to church, Total Wine stores are open everywhere. Now, if you can catch a virus in a small business, a restaurant, or a church pew, you obviously can also catch it in a Target store or a Total Wine store. But governors knew that if they closed the liquor stores, there would be pitchforks in the street. And so in every state, the liquor stores have stayed open. So we've had a situation where governors have gained politically by proclaiming a grave emergency and supposedly taking strong action to combat it. While at the same time, the shutdowns have been so full of exceptions that they didn't seriously inconvenience most people, unless, of course, their jobs or their small businesses were impacted. As a matter of fact, you can't find any apparent correlation between the severity of a shutdown order in a given state and the number of COVID cases or hospitalizations or deaths in that state. There doesn't seem to be any correlation at all. And I think if we drill a little deeper, we find another political element. The COVID shutdowns devastated small businesses, putting many thousands into bankruptcy. But big business, and Alex mentioned this too, big business has largely prospered. Thus, for example, Target, Walmart, Costco, Home Depot, Amazon, and Apple have all achieved record share prices during the COVID epidemic. This is one reason why the stock market has been so weirdly buoyant after the initial shock in the spring. So big business is largely happy with the shutdowns. Well, who else hasn't been bothered much by the lockdowns? Public employees. I assume there are exceptions here and there, but generally public employees have simply continued to draw their paychecks and in some cases to get raises, whether they were actually performing any work or not. That doesn't give them much to complain about. Who else hasn't minded the pandemic? Urban knowledge workers. These folks, for the most part, are able to do their work at home and on Zoom, and many of them prefer it that way. For many urban knowledge workers, the shutdowns have mostly been a plus. Now ask yourselves, what are the key constituencies of the Democratic Party? They are big business, not all of it, but most of it, public sector employees, and urban knowledge workers. And as it happens, those are the constituencies that have generally been least injured by the shutdowns. Now, on the other hand, what are the key constituencies of the Republican Party? Small business and rural America, the very elements of our society that have been devastated by the COVID shutdowns.